Welcome to another tips and tricks case. Have a look at this chest radiograph and see if you catch any abnormalities. Here's a lateral chest x-ray on the same patient. To understand what's going on with this patient, let's look at a normal chest x-ray. This is a normal posteranterior chest radiograph. The area of interest here is that at the hilum. So if you look at the right hilum and the left hilum, you should always assess the hilar for four things. The first thing to assess is the location. The left hilum should be slightly higher than the right hilum in any normal patient. The second thing is the size. The hilar size should be equal, and that's something you get used to by looking at lots of chest radiographs. So any enlargement would raise a question for hilar abnormality. Third thing is the contour. There should not be a bulging or lobular contour of the hilum. And finally, the fourth thing to assess, which is the most difficult, is the hilar density. A hilum that is even slightly more wide than the other side, if you exclude any technical factors, is considered abnormal. That's another thing that you get used to by looking at lots of chest x-rays and gaining experience. Now let's go to a normal lateral chest radiograph. One of the things that I found being peculiar with students and residents is that they ignore the normal anatomy and they ignore looking for abnormalities on lateral chest x-rays, and I think that's mainly because they do not understand it clearly, although it is more simple than what you think. To make the concept of understanding the lateral hilar anatomy easier, we'll link that to a metaphor. Let's start by understanding this. In many cultures, the right hand or the right side of the body is considered better and superior. So in many religions, many cultures, the right hand is considered the good hand. Similarly, to remember this fact as well, remember that self-righteous people think they are superior and ahead of all others. Keep this in mind as we proceed with the lecture. It will be of use as we explain further. The easiest thing to identify on the lateral x-ray would be the heart and the aortic arch. Now, there's a concept that we need to understand before going further. Let's enlarge this area on the frontal chest x-ray. This is the trachea, this is the left bronchus, and this is the right main bronchus. Note that if you look from the patient's side, you would never see the main bronchi as circles or oval structures, since they have an oblique course. However, we know from our anatomy that the right bronchus gives a branch early on, which is the right upper lobe bronchus, and this is horizontal. So if you look from the side, that would look like a circle or an oval structure. And we know that the left main bronchus is longer, and it also gives the left upper lobe bronchus, but at a more inferior slice compared to the right. This would also look like a circle or a rounded structure if you look from the patient's side. To understand that further, let's look at a CT scan. Now let's understand this on a CT scan. If you look here, you're looking at the trachea. As we go lower down, the trachea bifurcates at the carina, and the right mainstem bronchus is very short. It almost immediately gives you a horizontal branch here. This is the right upper lobe bronchus that is horizontally oriented compared to the mainstem bronchus on the right, which is oblique. The mainstem bronchus then continues as the bronchus intermedius. If we look at the left side, here's the bifurcation again. This is the oblique left mainstem bronchus, which after a while gives you a horizontal left upper lobe bronchus, as you see here. Now let's cross-reference what we're looking at here with a sagittal image. So this is the trachea again. Notice how we go lower down. You're still in the trachea, you go to the bifurcation, then you have the right mainstem bronchus, which is short, and gives you a horizontal right upper lobe bronchus. Now this right upper lobe bronchus on a sagittal image looks like a rounded or oval structure, as you see here. This is compared to the other side, where the left mainstem bronchus is long After a distance, it gives you a horizontal left upper lobe bronchus, which also looks like a rounded structure or a circle. So let's look again at a normal lateral chest x-ray. This is the trachea. As you go lower down, you could see a dark circle which is high above. So this represents a bronchus. There's another dark circle below. This represents another bronchus. From what we understand, the bronchus that appears as a circle when you look from the patient's side is that of either the right upper or the left upper lobe bronchi. And the bronchus that arises superiorly is the right upper lobe bronchus, while the one that arises a few slices below is the left upper lobe bronchus. So looking here, the circle above is the right upper lobe bronchus. The circle below is the left upper lobe bronchus. To apply the concepts that we talked about, remember that the right side or the self-righteous people are more superior and think they're on top of the world and they're better than others. So right upper lobe bronchus is superior. As we proceed, you could see that there is a faint soft tissue density here. From your normal anatomy, you know that this is the shadow of the aortic arch. Now, there are two other densities that you see that are related to the hilum. One that is here, and this looks like a small mini arch. This is actually the left pulmonary artery. So remember, the left pulmonary artery looks like a small mini arch. And there is another rounded or oval white structure that is the right pulmonary artery. Again, if we go to our concept, the right hand is better, or the self-righteous people, they're ahead of others. So the right, which is the yellow arrow, is the right pulmonary artery. It's anterior compared to the left pulmonary artery, which is the green arrow pointing at a mini arch. Again, the right pulmonary artery is anterior. Now let's quickly revise what we talked about. The lateral chest x-ray shows the trachea, the right upper lobe bronchus, which is superior and above to the left upper lobe bronchus. Remember, you cannot see the main bronchi because they are oblique. If you look from the patient's side, where you're going to see the two circles of the right upper and the left upper lobe bronchi. Additionally, we understand that we could see the aortic arch on the lateral x-ray. We could see a mini arch, which is the left pulmonary artery, and an oval or circle anteriorly, which is the right pulmonary artery. So the right pulmonary artery is anterior, and the left pulmonary artery is posterior. One of the important concepts to understand is that seeing the right upper bronchus or the left upper bronchus is not a guarantee on all cases. In some cases, you might see both. In others, you may see none. And in some cases, you might see either one or the other. And that depends on mainly the patient's body habitus and the technique. So if that happens, and if you see one circle, you could not identify the other. How would you know that this circle represents the right versus the left upper lobe bronchus? So let me ask you this. Who's more fun? Is it the boring, always studying, self-righteous, right-sided good guy? Or is it the wicked, left-sided bad guy? Of course, it's the left-sided guy. It's always more fun to hang out with the bad guys instead of the good guys. And that's something to remember when you see only one circle, where you're wondering if this is representing the right or left upper lobe bronchus. So always look to see if it's surrounded by people or things. So if it's surrounded by the vessels, mainly the left pulmonary artery and the right pulmonary artery. So this is the bad guy who everybody wants to hang out with. That makes it easier. So left upper lobe bronchus is surrounded by vessels. If we go back to the quiz case, some of you probably have wondered about the abnormality that involves the left hilum, and you're right. So out of the four things that we look at, remember we talked about location, size, contour, and density. The right hilum appears normal in comparison to the larger left hilum, which also has a more bulging contour, so it has a contour abnormality. If you're suspecting this and you're not sure, then now you could utilize your knowledge in the lateral hilar anatomy. Looking at what we know, we understand that this is the trachea. Then you have a circle that seems to be surrounded by vessels. So we know this is the bad guy, the left upper lobe bronchus that is surrounded by vessels. This is the more rounded or oval, anteriorly located pulmonary right pulmonary artery. And this is the more supposedly mini arch kind of left pulmonary artery, but it appears to be more dense and more bulging, which confirms the left hilar abnormality that you suspected on the frontal x-ray. Looking at the CT scan of the same patient, you could see that you actually correctly detected a lesion which was a primary lung cancer. To summarize what we talked about, first of all, when you look at the hilar, experience would play a role, but always look for the four things: the location, size, contour, and density, and understand your lateral hilar anatomy. The right upper lobe bronchus, which is more superior than the left upper lobe bronchus. Remember, you cannot see the main bronchi, you see the upper lobe bronchi. The mini arch or the left pulmonary artery is posterior, while the more self-righteous right pulmonary artery is more anterior. Now here's the fun fact about this clip. All the images that you've seen have been generated by AI using prompting. They were actually fun to do. Thank you for watching and hoping to see you with more later.